Hello, my name is Dr. Alison Walker, Chair of JR Calc and Executive Medical Director at West Midlands Ambulance Service. Welcome to this short video presentation for the JR Calc Clinical Update 424, the fourth and final release for this year. I'll give you an overview of the updates that have been introduced in this latest release and also point you to further video presentations that go into more detail on some of the bigger updates that have been completed. Firstly, we reviewed the drowning and overdose and poisoning in adults and children guidelines. These have been fully reviewed and updated. Further maternity updates have been included, including cord prolapse, which now sits as its own tile, imminent birth, which has been fully reviewed, and we've also introduced a new pre-hospital maternity decision tool to assist with the identification of low, medium and high risk clinical concerns related to the patient's parameters, symptoms and amount of blood loss. We've made a number of smaller updates to guidelines based on feedback we've received and reviewed. We looked at overdose and poisoning in adults and children. This guideline has been fully revised and updated with support from the National Poisons Information Service, the NPIS, and the Royal College of Emergency Medicine Toxicology Group, ensuring that our information is up to date and aligns with expert guidance. The revision includes the removal of the substance management table and instead now points paramedics to contact ToxBase as per local trust procedures. This guideline has been updated to support paramedics in their decision-making processes with the support of specialists in this area, and we've included a new algorithm to support this. We've also, following feedback, reviewed our dexamethasone guidance and looked at paediatric doses. A review has concluded that the doses needed to be revised, and we've now completed this. We've also had a look again at acute coronary syndrome information, and within the guideline we currently have a section and wording about health inequalities. We have made small changes to wording around women and presentations of ACS to clarify that women can present with different symptoms to men. We have said, while symptoms vary from person to person, there are no symptoms that women experience more or less often than men. And we've changed that to women with ACS do have different symptoms at presentation than men with ACS, but there is also considerable overlap. Although most sexes present with chest pain, women with ACS have higher odds of presenting with pain between the shoulders, nausea or vomiting, or shortness of breath. This change was based on a systematic review, and the related reference can be found within the guideline. Following some feedback we received, we've made a slight amendment to the management algorithm for anaphylaxis and refractory anaphylaxis. Salbutamol has been removed from the bottom of the anaphylaxis algorithm, and the refractory algorithm now states that salbutamol and ipratropium can both be considered for managing bronchospasm. Due to previous changes in JR Calc trauma guidance around extrication and the use of cervical collars, small changes have been made to the spinal injury and spinal cord guideline to bring it in line with this. We are aware of an ongoing randomized controlled trial, the Spinal Immobilization Study, or the SIS study, which will report once completed. We will review the results from the study. A number of ambulance services are involved in this research, and we anticipate the results will influence future revisions of JR Calc guidance. The research pace is an evolving area for this, and individual trusts may update their own guidance based on evidence that is still under consideration by JR Calc. All the updates for 424 can be seen on both the JR Calc Plus and ICPG apps within the Guideline Updates box at the bottom of the dashboard. Users will also see the updated tag on the guideline or medicine itself within the Guidelines and Meds tabs. I'd like to thank all the paramedics, other clinicians, including pharmacists, midwives, and many others who have given up their time to contribute to these updates. And we are always keen to hear any feedback, so please get in touch with us if you have any.